It's never too early to start getting ready for the holidays, especially when it comes to your skin and body. We get so busy with everything else in our lives, it's best to start taking care of yourself now. Dr. Rosh is back with us today to help us out. So welcome back to the show. Always great to have you here.
So excited to be here as always.
Yeah, I know. So when we start thinking about the holidays, we're like, we want to look our best, right?
Yeah.
So what are some things we can start doing now to get ready for those holidays?
Yes, well, they're coming up so quickly. Really important. Get a good skincare regimen in. The weather's changing. And it's nice to keep that skin hydrated, nice and moist. We're really excited to be able to talk about skincare consults with all of our patients when they come in. A laser skin resurfacing, you know, we've all been out and about in the summer, getting that sun damage, even if we wear sunblock. And fall is a great time to erase those blemishes, get rid of those red spots, and really get our skin holiday ready.
Okay, so let's talk about the lasers. So, you know, what kinds of lasers and how much downtime do I need to prepare for if I want to get a laser treatment?
So we have a whole array of lasers at OSCLI, broadband light, Moxie, fantastic treatments, very minimal downtime, able to address reds and browns on the skin. And the Moxie portion helps make your pores smaller, give your skin a nice overall improvement in texture. Very minimal downtime. You know, patients come to see me on a Friday and they're ready to go to work and show their face on Monday.
On Monday, okay.
So,
now, are these the before and afters of some of those? That's
yes.
That's a BBL. Is that different?
BBL Moxie.
Okay,
so
so
two
it's all the
lasers
same.
in one.
Oh, two lasers in one.
And
Okay.
we have erbium and CO2. We like to plan a little bit more downtime for those patients, but very easy to recover from. We're able to provide exosomes on patient skin, which helps them heal, helps their inflammation go down very quickly, and so they're just ready for an event or the holidays or both.
Yeah. Okay, so let's talk about, I know you really specialize in the eyes, in eyelid surgery. So can you kind of explain exactly what that is?
Sure. So I perform laser-assisted eyelid surgery, and when I look at the eyelid or the brow, we kind of look at it as one unit. We have to address the brows, the eyelids, the eyelid muscle, and the lower lids as well. Patients are coming to us younger and younger. They're on Zoom, they're on Microsoft Teams, they're just on camera all the time, and the goal of the surgery is to rejuvenate that in a very natural way. We don't want to have patients come in and say, oh, you know, people have said, have I been operated on?
Right.
We
or have that like look where you look like you're like
deer
really
in headlights.
deer in headlights.
Yes, absolutely not. That is not our vibe. We want patients to look very natural, refreshed, rejuvenated, just a better version of themselves. We want them to be able to turn back the hands of time, even if it's 5, 10, 15 years, not only for an improved cosmetic result, but also a functional one. We have patients say right when they get off the table, wow, I can just see better. And that is just fantastic. I tell all of my patients, if you're getting ready for an event or holidays or whatever it may be, make sure you come see me a couple months. Give it a couple months for your body to heal, decrease your bruising, and for you to really see the end result. Because that's what you want when you're going to be going off to a big event.
Absolutely. So who's a good candidate for eyelid surgery? Maybe let's start with like the upper eyelid surgery.
Sure. So patients who feel like they have a lot of puffiness or just heavy weight on their upper lid. We have a lot of patients coming in saying that they have kind of a constant brow ache from constantly trying to raise their eyelids up. Come in, let me take a look. We can kind of discuss surgery potentially, or even non-surgical options. Sometimes laser skin resurfacing can kind of tighten up that crepey skin. But we do take insurance, and I also do cosmetic surgery. But when patients come in, we're able to kind of talk to them about an array of options, depending on their downtime as well.
Right, absolutely. And then you do the lower as well. And that's sort of like that bag that you see sometimes underneath the eye.
Yeah, and that's one of our absolute favorite surgeries. It's a very instant result. There's no scar and there's no suture, and so we're able to make an incision with our laser and take that fat out, and once the surgery's done, it's done. Very, very rare to have reoperation for that, and it's not metabolic fat, so just because you gain weight or lose weight, that has nothing to do with the eyelid fat at all, which is a very common question I have from patients.
So is that where the laser-assisted surgery comes in from the incision? Is that?
Yes, we're able to use, it's basically my magic magic wand. I'm able to use
Wow.
that to create the incisions, and after we take the fat out, we're able to nicely resurface that skin with the CO2 laser to get rid of that creepy texture, so that patients can really enjoy the younger looking eyelids.
Right, and I guess if you're going to have the surgery, you might as well do maybe a laser that has some downtime too. You can do that all at once?
Yes, you can do it all at once. We have a lot of patients who will kind of do a la carte. They'll do surgery first, and then they'll come to me at their post-op, and we'll do some laser then.
Wow,
So-
that's amazing. So if we came to you right now, we could maybe get it done before the holidays.
Yes, come
All
in right now.
Remind me where you're located again.
So we have 2 locations. Our main location is in Lutz, a mile west of the premium outlets, and then our second one is in South Tampa.
Perfect. Well, thank you so much.
Thank you.
A lot to think about before the holidays.
We're so excited to see you guys.
I love it. All right, and you can reach out to Dr. Rosh by calling 813-303-0123 or head to Rosh.com.